According to a survey conducted by the CDC, over 5.4 million children have been diagnosed with ADHD. ADHD, or Attention Deficit Hyperactivity Disorder, is characterized by impulsiveness, inability to concentrate, and hyperactivity. Rates of ADHD diagnosis increased an average 3% per year from 1997 to 2006 and an average of 5.5% per year from 2003 to 2007. ADHD is a very controversial disorder. Controversy surrounds its subjectivity and its diagnosis process. Many people question why there has been such a recent increase in ADHD cases, and even if the disorder exists, this is Society on ADHD. We hit the streets of Alpharetta to interview people on their thoughts on ADHD. What are your thoughts on ADHD?
I believe ADHD is not a serious ailment, and a lot of people just make it up.
I think it's a stupid excuse. I think it's a stupid excuse for people just to be lazy.
Sort of that
Don't mind that,
Can you shut that off, please? Hey, excuse me? Excuse me? I'm trying to do some work. Quiet down a little.
I think it's a very real disorder that can affect people.
Do you happen to know anyone close that has ADD or ADHD?
Yeah, my older brother has ADHD.
ADD has definitely been on a rise in our generation because of all the technology we're exposed to, and I feel like that's really lowered our attention spans.
Go ahead.
All right, now we're recording.
Go ahead. All right, so as somebody who actually has little experience with ADHD and the medicine taken for it, what is your third-person perspective on this whole controversy?
I kind of see two sides to it because it's kind of contentious because a lot of people may think that it may give them an unfair advantage, especially in college admissions, because I know for a fact that some kids with ADHD or ADD, they get extra time on the SAT, like as much time as they want to finish the sections, which is like a huge factor for college admissions. But on the other hand, I mean, if they truly do need it as a form of helping them in their studies, but I don't know if they really deserve like that much aid in terms of academics.
Yeah, I think a lot of people use ADHD as an excuse to get medicine.
Get medicated! Do you see a real difference when he takes his drugs and when he doesn't?
Yeah, when he takes his drugs, he's like completely focused when he talks to me. Without them, if you try talking to him, he'll just like completely like stop thinking about what he's saying to you and like walk away as if you two were never talking.
I think that drugs just build addictions and can alter a lot of chemicals in your brain and just completely change your whole anatomy. So I just feel that you can definitely first make healthier choices in your life.
So, all right. Do you think if you have ADD or ADHD, do you think you're able to overcome this disorder without drugs?
Yes.
Why do you think that?
I think drugs is a crutch for overcoming it. I think people who claim they have ADHD are lazy and they just don't want to do their work, so they blame it on a medical issue.
Do you think the drugs used to help ADD or ADHD can have harmful effects?
Well, I think it's just people can become like addicted to it, not in like the feeling it gives them, but I think that like once they take it, they see the potential that the drug can do, so they'll take it and they'll be like, oh, I can get like all my work done, this is amazing, and then they keep on taking it even if they're not supposed to, and then that just forms a slight addiction. Today you can just answer like 5 questions that are really easy and they're like, oh yeah, you have it, but I don't think it's a true test to see if you have ADHD or ADD.
Do you think parents that do give their kids these drugs, do you think they're just passing up, trying to be a parent by trying to work with them to see if they actually have it, or do you think they're using it as an appeasement, or just try to get their kids off their back, or get them good grades in school?
Okay, yeah, I do. I think like no parent wants their kid to fail in school, so if they can just get the miracle drug, that will make their kid automatically get good grades and make their kid want to study more, then they're fine with it. Cause it's like, okay, let me just get the drug and they'll be fine. Because every parent, or most every parent's dream is for their kid to succeed.
We needed a professional perspective in the matter, so we interviewed a local doctor.
So what typically are the medicines given to treat ADHD?
Most commonly, there's Adderall, there's Vyvanse, Ritalin. Those are probably the big three.
And what effects do these medicines have on the child's behavior?
It's a stimulant, but it works the opposite of how you would expect. It calms the child down instead of wiring them up. So it makes them calm, where they can focus easier in class. But with that, comes some side effects. They sometimes don't want to eat. They have trouble sleeping, cause some anxiety and depression issues later on.
Are there any long-term effects they could have?
Possible depression, some long-term depression. A lot of the kids that are on ADD meds long-term end up on usually some type of antidepressant.
Do you think medication is a proper treatment or the best way to cure ADHD or to help it?
It helps manage the symptoms. I don't know that there's any way to actually cure it, but it does help manage it and helps the child do better at school versus being on nothing.
All right, go ahead.
So if they take the medicine for a while, do they gain tolerance for it? Do they have to keep?
The body will develop dependence, and you can become tolerant to it. So usually they'll increase the dose, or if they get to the point where decreasing the dose isn't an option, then they'll change the medicine and try something else.
I think there's a growth.
I'm asking you, an adult.
Okay.
Why do you think there has been a growth?
Well, because now it's widely more known. There probably ADD probably existed even before the last couple of years. People just didn't recognize what it is. Now I think there's an over-insurgence of people saying, "Oh, you do these things, you must have ADD." Today, children, if you examine medical research today, you'll find that our society over-medicates its patients, and many of them are children. That's the answer. You pop a pill, you're fine, right? The parents
Is it a social problem?
What is
ADHD?
Oh, I believe it's a large social problem.
While at the basketball courts, we met Noah Brosh, a student at Alpharetta High School who has ADHD.
Easton!
I got it.
At what age were you diagnosed with ADHD? I don't know, like 15? I was 15, I think. What's the diagnosis process? Doctor just asked you a bunch of questions. So it's all subjective. What does subjective mean? Number 10. Do you think you could overcome your ADD-related problems without drugs? Yes. I take ADD maybe once every 2 months. Alright. Do you see a difference in yourself when you're on your medicine? Only when I'm at school. So you don't take it besides school? I have taken it on weekends, but there's no difference. What milligrams of check? 30. Is that a lot? No, it's not really a lot. That's pretty small, isn't it? It's either the introductory one or the second one. It's like second introductory. It's not a lot.
ADHD is a difference in cognition, not simply a disorder. We are attention different, not attention deficit. But because it is treated and misunderstood as a disorder, it's treated as something that needs fixing. So the idea seems to be that we need to get rid of my ADHD. But there's no getting rid of it, there's just sedating it. I was lucky. My high school teachers were hip, young progressives who were delighted to give me extra time, the additional attention, and the overall freedom to express myself the way that I felt necessary. So many other kids with ADHD aren't as lucky. For example, my roommate. Adam has been my roommate for 4 years. He is an excellent actor in the School of Drama and a brilliant thinker. We both grew up in Dallas, Texas, and we both have ADHD. Adam's high school was different. Now, even though he grew up only 15 minutes north of me, Adam's high school had harsher penalties for falling out of your chair. Now, you see, when you're a kid diagnosed with ADHD, your doctor administers a series of amphetamines, and everybody waits, because no one has a clue how you'll react. You might get more calm. You might become depressed. You might lash out at the people around you. Now, the difference between Adam and me is when a new medication may cause me to act out, my teachers immediately advise my doctors that I change my medication. However, when Adam tried a new medication, his teachers wrote this in his report. Adam is less motivated, less animated, and less involved in class activities, but at least he's quiet now. Adam is less motivated, less animated, and less involved in class activities, but at least he's quiet now.